Thank you for giving me the opportunity to speak. I wanted to talk about what's going on with EEE virus. Last year, we had the largest outbreak of EEE virus in more than 50 years. And most of those human cases were centered in the Northeast in just 4 states, in New Jersey, Connecticut, Rhode Island, and Massachusetts. So I wanted to talk about sort of the long-term trends that are leading up to increased activity of this virus, and then talk a little bit about our state experience in Connecticut and the program that I'm involved with. So by way of introduction, EEE virus is a rare disease, causes a rare disease, but it's a very serious illness. It's the most lethal arthropod-borne virus in North America, and it kills about 40% of hospitalized cases. Of those that survive, about half of those individuals suffer from lifelong disability and neurological impairment. There's no commercial vaccine, at least for humans. There is a vaccine for horses, though. There is no effective antiviral treatments for people either. It's just supportive care. And on average, in the country and throughout the US, there are about 6 to 7 human cases per year. But this virus can cause disease outbreaks where cases cluster in space and time. And as you can imagine, this causes a lot of fear and concern, and justifiable fear and concern among the public when there is an outbreak. The virus activity is really focused in and around freshwater swamps. So it's highly focal, very geographically specific to certain, habitats. And it perpetuates in a bird-mosquito transmission cycle, with the principal vector in the northeastern US being Culicida melanura. This is a species that feeds predominantly on birds and is the primary vector involved in virus amplification. So this just shows kind of a broad map summarizing all the reported human cases since it was a reportable disease starting in 1964. And you'll see that there really are a few focal areas. Most of the human cases occur in Florida, but also there's a cluster or a number of cases reported in Georgia. There's another focal area up in the northeastern US. Massachusetts has the second highest number of reported cases nationally, but also New Jersey is another hot spot. Fortunately, in Pennsylvania, the number of cases are extremely, well, there's only 3 reported human cases since 1964. So Pennsylvania has been largely spared from this virus. And then there's another focal area up in the upper Midwest, particularly most of the cases centered in Michigan. So if we look at the northeastern US, which is really one of the focal areas for the disease, you'll see that if we look at the long-term trends, the number of human cases are increasing over, really, we're in a period of resurgence starting back in 2003 to today. And you'll see, if you look at the number of spikes in cases, there was a spike in 2005, another spike in 2012, and then there was the outbreak last year in 2019. And you'll see these outbreak years are occurring in increasing frequency than in the past. So if you look historically, prior to 2003, there was really only one spike of cases in 1968 and another spike in 1983. So there were these long periods of time where there was really very low to no virus activity. Well, that is changing now. We're seeing higher levels of virus activity, and we're also seeing a northward expansion where human cases are occurring further north into northern New England, New Hampshire, Vermont, and Maine. This just shows you the reported cases for 2020 so far this year. I just took a snapshot from the CDC website. Actually, you can't really see it from this map, but most of the human cases are we're in Massachusetts. There are 5 reported human cases, and then just a few cases in Michigan and Wisconsin this year. So when we look at the factors contributing to the resurgence of EEE virus, there are a number of long-term changes in the landscape that are likely to lead to more EEE virus transmission, starting really way back to the turn of the century with the abandonment of agriculture in the Northeast, and much of the land has been restored to its forested state. This creates the appropriate habitat for the main vector Culiceta melanura, which are these forested wetlands. So with wetland restoration and forest reforestation, that will lead to increased habitat for Culiceta melanura, also for the birds that transmit the virus as well, or involved in virus amplification. If we look at these changes over time, there's been a lot of growth and development and fragmentation into the forested sites and development around these critical wetland habitats, which will serve to increasingly expose people to EEE virus infection. And then finally, the climate is changing as well in our area, and we're seeing milder winters, warmer summers, and both extremes in precipitation and drought. And this will likely have a number of impacts on mosquito populations. It could enhance overwintering survival of Culiceta melanura, extend the transmission season, so we have a longer mosquito season each year, and accelerate the generation time of mosquitoes with warmer weather and increasing the frequency of blood feeding as well. And this could also allow the mosquitoes to expand their range northward, particularly Culiceta melanura, which is the main vector. And we're seeing EEE virus as far north now as Canada and up into Maine. So this is likely a result of climate change as well. So I want to talk a little bit about the EEE outbreak last year. In 2019. So nationally, there were 38 human cases. 3 of these human cases were located in the northeastern US. And what you'll see is the focal areas primarily in southern New England and up in New Jersey. Just wanted to point out that you'll see that there are these sort of focal areas. There's a focus of transmission up in the sort of Great Lakes area of New York, where they have abundant swamp habitat, and as well as in southern New Jersey, eastern Connecticut, and into Massachusetts and Rhode Island, and that is largely a function of where the mosquitoes are found that transmit the virus. So when we look at what happened last year, it's worth kind of revisiting some of the conditions that are known to favor EEE outbreaks. So this is, if we look at sort of the EEE literature, there are a number of variables that have been identified as important risk factors for EEE virus transmission and outbreak years. One of them, if we look at sort of the early season indicators or the proximal factors that may lead to EEE in a given year, one of the big risk factors is significant EEE activity in the previous year. So we know from genetic data that we've done and other people have done that actually EEE is maintained year-round in Florida, and the strains that come up into the northeastern US are probably brought up by migratory birds. Once they're introduced into the area and the virus is seeded in our region, the virus will persist for a couple years. So if you have significant EEE virus activity in 1 year, you're likely to see it reoccur the next year. So that's one risk factor. And that was one risk factor that wasn't found last year. One of the other risk factors is mild winters with insulating snow cover. So Culiceta melanura overwinters as larvae in these subterranean crypts, that little water pockets that form in the base of trees. And if the water is not allowed to freeze over, that will lead to higher survival of those larvae, resulting in a larger population the following year. And we definitely had a milder year left prior to 2019. High water table also in enzootic swamps, that factor was met in 2019, as well as a higher rainfall in the prior fall and winter and spring. If we look at sort of indicators of high risk of EEE, some of the variables include above average Culiceta melanura populations, EEE virus isolations from mosquitoes in June or early July, so early emergence of the virus. That condition was met in 2019, as well as isolations of EEE virus from mammalian biting mosquitoes, such as Cochleatidia perturbans, and that also occurred in 2019. Numerous EEE virus isolations, yes. High infection rates in Culiceta melanura, yes. EEE virus activity beyond traditional areas, yes. Early and above average equine cases, and finally an infection of a human prior to August. So we knew actually kind of early on, we were kind of in for it in 2019, given all of these factors were in place in 2019. It really was a perfect storm that led to that massive outbreak last year. So a little closer to home, I just wanted to talk about the data or the monitoring program that I've been involved with since 2004. This was established in 1997 after a EEE outbreak in 96. And we're monitoring mosquitoes by trapping them at we're up to 108 locations statewide. Each site, we set 2 kinds of traps, CDC, CO2 baited light traps, and gravid traps. And then all the mosquitoes that are collected at these locations, we set the traps on a 10-day rotation at each site, and all the mosquitoes are brought back to our lab in New Haven, are sorted, identified to species level, and tested for virus infection. And this serves as the backbone of our surveillance program. It provides an early warning system and allows us to assess risk of human infection in advance of human cases. So this is a summary of all the EEE virus activity, really since '96 in the state of Connecticut. And you'll see all the dots represent mosquito trapping stations in the state. And a lot of the traps are set in sites where West Nile virus is at risk, in those more urban districts indicated in red, up in the Hartford area, New Haven area, and in this urban corridor between New Haven and New York City. But what you'll see with EEE virus is actually it's kind of the mirror image of West Nile virus. It's found in more rural areas. And for Connecticut, it's primarily focused in the southeastern or eastern part of the state, particularly along the Rhode Island border. These are areas where we repeatedly detect EEE virus in mosquitoes over multiple years, these larger black dots. And so one of the things I want to point out about EEE is it's very geographically associated with specific locales. It has a geographic specificity. So it's very predictable in terms of where you're going to find it. It's not very predictable in terms of if we look at variation by year. So if you look at this histogram down on the right hand corner, lower right-hand corner, you'll see number of virus isolations per year, and we get these spikes of virus activity about every 5 years, including in 2019. And so that is largely somewhat driven by weather variables, weather variation, but there are other factors as well that are behind those, behind that variation we see from year to year. I also want to point out, so we've known about EEE for some time, and we've had actually, there have been reported equine cases dating back to the 1930s in Connecticut. But human cases are a new phenomenon. So we had our first human case in 2013, or I should say documented human case. Maybe there were more before it and we just didn't know about it. But there was a human case right up on the Connecticut border, Rhode Island border. And then in back in 2019, we had actually 4 human cases last year, and those were focused or concentrated in this lower Connecticut River Valley area. And so that was a little surprising to us because most of our virus activity is right up along the Rhode Island border. And so it was in a kind of a new region for us, and in an area where we don't have a lot of mosquito traps to begin with. So it was very frustrating when that outbreak hit because we didn't have the traps where we needed them. This just shows sort of the habitat where we're finding EEE. These are kind of the textbook kind of locations where Culiceta melanura is found. The larvae develop in water in these underground crypts, little water pockets that form at the base of swamp trees. And sometimes you have to go really, really far down with your dipper to get to the water where they're found. So it's these very cryptic habitats. Sometimes they're found in a little more open pools, as you see up in the left, upper left panel. But for the most part, it's very hard actually to sample the larvae themselves. And you can imagine this would be also very hard mosquito species to control by larviciding, and so because they're in these very difficult, inaccessible, they're developing in these inaccessible habitats. So this just shows a summary map of EEE virus activity last year. As I mentioned, we had 4 human cases in Connecticut. Also, we had a number of equine cases, most of those in the Connecticut River Valley area, as well as a few cases along the Rhode Island border. We knew back in 2019 we were in for it just based on our looking at numbers of Culiceta melanura per trap week. The numbers were well above average. They were about 2 to 3 times higher what we normally collect in any given year. This blue line shows the long-term average over 24 years of collection data. And we see that Culiceta melanura were well exceeded historical norms that year. And we're kind of holding our breath, hoping that EEE virus would not be introduced into our area because we knew it was really the perfect conditions for this virus. So this shows the epidemic curve of EEE virus in Connecticut based on, so the bars show detection of virus in mosquitoes, and the red bars show detection in avian biting mosquitoes or non-mammalian biting mosquitoes, primarily Culiceta melanura. The blue lines show detection of virus in mammalian biting mosquitoes. And what you'll see is that we first collected the virus as early as late July. And what I think is really worth pointing out here is just how rapidly the virus will escalate. You know, from our first detection of the virus, we very rapidly saw a steep buildup of virus. The first horse cases were they weren't reported, they were the date of disease onset was as early as the first week of August. So the horse cases followed soon after we detected it in mosquitoes, and human cases were started in the third week of August till the middle of September. So I just want to sort of point out how little time you have when EEE hits and it starts to take off. You really don't have a lot of time to react to it, to prevent, human cases or horse cases for that matter. This just shows our breakdown. So we detected, breakdown of EEE virus in mosquito pools by mosquito species in Connecticut during that year. So we detected the virus in 122 mosquito pools representing 15 species. The vast majority of infections were detected in Culicida melanura, and followed by a number of other species. Some of the species have been implicated as potential bridge vectors because they feed opportunistically on both birds and on mammalian hosts and humans. And that includes species like Cochleatidia perturbans. We had 6 detections or 6 positive pools of that species. Ochlorhynchatus or Aedes canadensis, we had 5 positive pools. Aedes vexans, we had 4 positive pools, and Culex salinarius, we also had 4 positive pools. So we're detecting it not just in bird-biting mosquitoes, but also significant detections in some of these potential bridge vectors. So, I mentioned that we had these 4 human cases in 2019. And I think it's worth to go back and look at our historical data for as long as the program has been in place and really compare what we found that year to other years. And looking at that data, there's nothing that jumps out when we look at the surveillance data that, we've had other bad years for EEE, but not necessarily human cases. In 2003, we had 87 positive pools. We also had a number of infections in other animals, in pheasants, in horses. We actually had penguin flock that got infected from Mystic Aquarium. 2009 was another bad year. We had 123 positive pools, a couple of pheasant flocks, a horse case, and finally the first human case was in 2013. So it wasn't clear looking at the mosquito data that there was, what was remarkable about 2019. Well, we've had other years with high levels of virus activity and gotten through the year without any human cases. There's nothing obvious looking at that data. The only thing I can say is if we look at the virus detection by week and look at the mosquito data, we see that at least in the 2 years where we had human cases in 2013 and in 2019, that those were years when we detected the virus much earlier in the season. In Connecticut, unlike some of the other states like Massachusetts, which detects it very early on in the year, we usually don't pick up the virus until middle to late August at the earliest. But 2019 and 2013 were remarkable years where we saw early seeding of the virus, detection of the virus. And so that may be an important risk factor going forward for outbreak years of EEE virus. So with the detection of EEE and the additional 4 human cases, we expanded our trapping program last year to increase trapping coverage in Eastern Connecticut. One of the lessons from 2019 was we just simply didn't have enough trap coverage in some of the areas where many of the human cases were concentrated. So with some additional funding, we increased our trapping presence in that area, and so that's something that we hope to continue moving forward. It will really depend on funding from the state level But this year we were able to increase our trap presence in those areas to look for the virus. And despite increased trapping this year, we detected very little in the way of virus. EEE really kind of dropped off the map this year. We had 2 positive pools this year. We're still trapping mosquitoes and we'll continue till the middle of October, but I doubt that we're going to see much more at this point in the year. And so we had no human cases or no horse cases. So we caught a break this year in terms of EEE. West Nile virus is a different story. We had a lot of West Nile virus this year. So what happened this year? Well, if we look at the Culiceta melanura numbers, you'll see that they dropped off. They were about average starting out. We had a spike kind of in late June, early July. But then the mosquitoes really declined precipitously throughout the rest of the summer. We never saw the emergence of a 3rd generation, which we sometimes see in sort of late August, early September. That just didn't happen. It was so dry. And this just shows a summary of the rainfall data for 2020 so far in the northeastern US, and you'll see in New England, really throughout New England, it's been really dry, and those conditions are not favorable for Culiceta melanura, which requires a high water table in those swamp habitats. So we think that's what happened. This virus kind of lives and dies with Culiceta melanura abundance. And so with that, how am I doing on time? Oh, on time. All right. Well, I just want to thank my colleagues at the Connecticut Agricultural Experiment Station. And I wanted to especially thank Ted Andriotis, the former director of the mosquito program, for lending many of his slides and for this presentation, and all the staff that do all the hard work to collect the data that I presented for the talk, and also our partners in the Department of Public Health, Department of Agriculture, Environmental Protection, and folks at US Navy Groton Base who allow us to trap there as well. And with that, I will take questions if there's time.